Hello, I'd like to welcome everyone to Module 2, Communication and Practice. So for the first part of this module, we're going to be discussing the role of the nurse in the mental health care setting. Specifically, what are some of the tasks that the RN is expected to complete or is able to complete within the scope of their practice. So we'll be talking about what are the elements that we want to cover in a psychiatric assessment, what is the role of the RN in the interdisciplinary treatment team. We'll briefly touch again on therapeutic communication skills. We'll discuss briefly group therapies, and then we will discuss placing patients in an appropriate level of care and kind of what the nurse's role is and all of that. So, what is the role of the nurse in the psychiatric mental health care setting? So I want you to take just a couple minutes to think to yourself, what is the nurse's role? When you are done doing that, start up the video again and we will continue our discussion. So what is included in the role of the RN? Well, first of all is going to be some things that are very similar to other units and things that are a little bit different. One of the things that is going to be similar is assessment. Now, this assessment, remember, this is not a one-time event. This is an ongoing event. This is, even though we talk about the assessment as that big thing that we do right at the beginning of our nursing process, we are constantly assessing our patients. We're assessing them during every interaction. We're assessing them on a day-to-day basis. We're assessing them after they take medications, after they come back from therapy, after they have completed specific tasks. Just keep in mind, this assessment is ongoing. It's not something that we stop just because we completed the first assessment that we do with the patient. Now, another huge part of what the nurse is responsible for in the psychiatric mental health care setting is maintaining safety. Now, this is safety both for yourself and for others. This is incredibly important in the psychiatric setting specifically because a lot of times in psychiatric settings, patients are admitted involuntarily, meaning that we're taking some of their autonomy away, some of their ability to act and make decisions on their own, which means that we're also taking on the responsibility for their safety. Patients can also sometimes act erratically or even violently, and making sure that we're maintaining their safety and the safety of others is going to be our top priority. So that is one of the issues here that we need to be specifically aware of, even though we're always going to be concerned about patient safety in every area of nursing. Another responsibility of the mental health nurse is medication monitoring. So with psychotropic medications, administering those medications, monitoring for the effects. So we're looking for both the positive effects, what we are anticipating, or the target effects, and any adverse side effects. So is the patient getting the benefit out of this medication that we want? Are they getting the anticipated effects of this, the reasons that it's prescribed? And are we seeing any of those negative side effects or any of the adverse side effects or the negative reactions? We also want to monitor for adherence. So with in the psychiatric setting and with psychotropic medications, one of the things that the nurse is specifically responsible for is making sure that the patient has taken their medication as prescribed. So sometimes, especially in inpatient lockdown units, this will also require the patient to take the medication, open their mouth, stick out their tongue, make sure that they're not actually cheeking the medication or, making it look like they've swallowed the medication when really they haven't, and then they go and dispose of it later. Sometimes, depending on the kind of acuity of the patient, you'll actually have the patient, sit at the nurse's station for a specific amount of time. But you also just want to, in general, kind of keep an eye on patients after you've given them medications to make sure that you're monitoring for that adherence. The nurse is also in charge of educating patients about the importance and effects of medications, and the nurse also makes decisions about when PRN medications can be given. So PRN stands for, or basically means, the as-needed medications. So when are those as-needed medications required? Sometimes this will be patients asking for them. Sometimes it will be the nurse's decision whether or not those medications should be given. Another important role of the mental health nurse is patient advocacy, actually advocating for our patients, making sure that we are doing what's best for them and that we are speaking up for them. As we saw in our lecture last week, there has been a long history in mental health care, and using care in scare quotes, that we haven't done a great job of taking care of these patients. So it is vitally important that we make sure that we're advocating always for their best interests. The nurse is also going to work as part of the interdisciplinary treatment team. We'll come back to this in just a moment. The nurse is also going to use therapeutic communication skills to help benefit the patients. The nurse is going to help develop the nurse-patient relationship and foster good communication and trust. The nurse is going to be in charge of education, not just with medications, but with discharge planning, with treatment adherence. The nurse is also able to facilitate treatment groups. Again, we'll put a pin in this for right now, and we'll come back and discuss this a little bit in a little bit more depth in just a moment. The nurse is also responsible for milieu management, or basically making sure that the environment that the patient is in is safe, is structured in a way that is beneficial to their mental health. And this we'll actually discuss in more depth in our discussion next week. So hold on to that also. So we started off our discussion talking about the importance of a mental health care assessment. So when we're thinking about a nursing mental health assessment, what needs to be included in that? So I want you to take just a couple of minutes, pause the video again, and think about what should be included in a nursing mental health assessment. When you've gotten a couple of answers or have formulated a few ideas, start the video again and we'll continue our discussion. So what should be included in a nursing mental health assessment? Well, one thing that should be on the top of our list is basic demographic and admission information. So that's going to include things like the patient's sex, their date of birth, their race, all of that kind of information that's going to identify them. We also want to talk about their reason for admission. So the way that we kind of want to conceptualize this is, what was the disturbance in their pattern of daily living? Kind of what was the reason that something changed that they needed to be admitted to a higher level of care? So was this a psychotic episode? Was this a discontinuation of their medications? Was there some kind of external tragic event that happened? Some type of physical abuse, some type of emotional trauma that was happening? We also want to make sure that we're documenting their previous psychiatric history. So have they ever been admitted to a psychiatric care facility before? Have they had any outpatient care? Have they had any medication history with psychotropic medications? That leads us into kind of the next area, which is their current medical history and any medications that they're currently taking. So when we're talking about their current medical history, really what we want to do is kind of just focus on what is going to be most pertinent to their mental health. If there are large kind of overarching problems, like they have, some type of heart disease or diabetes, those are going to have an impact on their mental well-being. But we don't need to know everything about, if they had kidney stones 5 years ago. We don't need to know every single detail of kind of what was going on with that in their medical history. So again, those current and pertinent medical concerns are what we're are kind of like our biggest focus for this. Medications, we want to know any medications they're taking. This is also going to include any over-the-counter medications. And this is something that you need to be very careful about asking, because patients often won't kind of consider over-the-counter medications to be medications. They kind of just think of the things that they are getting from a doctor as medications. So make sure that you're asking, ask the patient, are you being prescribed any medications that you're taking? Are you taking any herbal supplements, any over-the-counter remedies, anything like that? There are some very specific over-the-counter medications that can have very, very problematic interactions with psychotropic medications. So we want to be really, really clear about asking for that. A lot of nurses will miss that, and that is information that is vitally important to get. We also want to know about allergies. So do they have any allergies to medication? And what are those kind of reactions that we would anticipate seeing with that? We want to ask about their substance use history, and this is important to ask for all of our patients. It doesn't matter if it is a 13-year-old, it doesn't matter if it is your bishop. You need to ask very specifically about substance use history. We don't make assumptions about anyone's substance use history. We need to ask them explicitly. Usually I recommend that we ask this in a couple of different ways. So instead of just asking, are you using any substances, we want to ask very specifically, are you currently using any alcohol? Are you currently using any tobacco? Do you regularly use marijuana products? Are you using any prescription medications that not for their intended purpose? Are you using any other illicit substances? So usually I want to hit those big ones. So alcohol, tobacco, marijuana are the ones that I want to name specifically. I want to ask about prescription medications, and then I want to ask I can leave all of the others in kind of a blanket of other illicit substances. When we ask that, we also need to make sure that we're not just asking these yes or no questions of, are you using alcohol? If they say yes, well, we then need to know, okay, how much alcohol are you consuming? How frequently is that happening? Is it that you are binge drinking on the weekends, but the rest of the week you're sober? Or is it that every night that you come home, you're having 2 or 3 beers? We'll talk about this later on in this semester when we actually talk about substance use disorders, but making sure at least that we have it in our minds now that is very, very important to ask those detailed questions, not just about if they're using it, but if they are, then what's the frequency? What has been the duration of that? If they've been having a beer every night since they were 17 and now they are 35, that's going to be different for someone that maybe compared to a patient that is having 2 bottles of vodka during the week, but they've only been doing it over the last month because they just lost their job and so they're stress drinking. So something like that. So again, just making sure that we're getting that context. We also want to be asking about their spiritual and cultural history. So do they have, what is the kind of place of spirituality or religion in their life? How important is that to them? How kind of central is that to their perception of themselves? With their culture, are there any kind of cultural considerations that we need to have in place? And these aren't always questions necessarily that you're going to be asking directly, but they're things that we need to be aware of and that we're assessing. We're also looking in that same vein at social support systems, kind of what is their network out in the community. One of the things that we're going to be doing really commonly in this is drawing out a genogram. This is something that you should have already gone over in the first semester, so I won't spend a ton of time on that, but kind of keep in mind that we're looking for, do they have good connections to their community, to a family or a family-like network? Do they have stable relationships, either romantic or friendships in their lives? So what other support systems are available to them? We want to look at their developmental level and their education level. So did they kind of meet the developmental milestones that we expect? These are going to be things like graduating in the expected time. They can also be things like, especially when we're looking at younger kids, the development of language acquisition, of different motor skills, so like being able to walk and crawl and things like that. We are also going to be looking at safety needs and risks. So we're asking our patients things like, are you currently having any thoughts of ending your life? If they are, then we need to ask further questions like, do you have means to complete this plan? Do you have a plan? We'll actually talk about this more in our discussion next week during when we're talking about the crises phase that can go on with patients. But again, keep it in your mind that this is something we are asking about. We also want to then ask about goals. So what are the patient's goals? What are their goals for treatment? What do they want to get out of starting treatment either at an inpatient facility or an outpatient facility. What are their ideas of what they want to do? Not just our ideas, but what do they want to accomplish? We also then want to ask about their mental status. So with the mental status, this is going to be several different things that some of them are questions that we'll ask directly to the patients. Other things are going to be based off of observation. So things like, is the patient able to concentrate and pay attention to what we're discussing? Does their intellectual functioning seem to be at an appropriate level? Are they oriented to person, to time, to place, to purpose? What does their mood and affect look like? So are they, does what their stated mood match kind of the outward expression of their mood? Is there clarity in their thoughts? Are we able to kind of follow their thought process? Do they have insight into their mental status, into their illness? These are all going to be things that, like I said, some of them are going to be direct questions that we're asking. Others are going to be things that we are going to pick up through the process of admission, of assessment, and of discussing these with them. So the interdisciplinary treatment team. So these are going to be the individuals that we're going to be working with. And what we're looking at is, again, this is going to be, there is some hierarchical nature to this, but we also need to understand that everyone has a different kind of role. That doesn't mean that one role is better than another. There's also going to be a lot of overlap between these roles. So even though we may have one thing that we're kind of focusing on, there might be other professionals that have a slightly different perspective that come at it with a slightly different kind of understanding. So looking at this, we have, of course, have kind of the ones that we would expect, so nurses and physicians. With physicians, we're looking at several different degree programs, so you can have PhDs, you can have MDs, you can have DOs, NPs, etc. So physicians is kind of a broader scope. We're also going to, part of this interdisciplinary treatment team, we're going to have therapists and counselors and social workers be a part of this, again, bringing a different type of perspective to patient care. We're also going to have physical therapists, dietitians. Our staff, such as our administrative staff and our support staff, are going to be part of this team. We're also going to have individuals like case managers and recreational and occupational therapists be a part of this team. Like I said, there's going to be overlap in all of these roles, but every one of these roles has special and unique responsibilities and special and unique perspectives. It's when we all come together and work as a team that we really are doing the best for the patient. This is one of the things that I'm really excited for you to see in clinicals. A lot of you will have the opportunity to work in a interdisciplinary treatment team and actually see these meetings go on. It can be really, really beneficial and kind of helps you see how this should function in other areas of nursing. So therapeutic communication is something that we'll touch on just briefly here. Remember, a lot of this is things that we already talked about in our preclinical lab. So I would definitely recommend that you review that sheet of therapeutic communication do's and don'ts that we went over. Just to reiterate, therapeutic communication is going to be those face-to-face interactions that are based on advancing the physical and emotional well-being of patients. It's important to remember again that this is a skill, meaning that practice is needed. No one is going to be perfect at this starting off. No one is going to be perfect at this by the end of the semester. No one is going to be perfect at this at the end of their nursing career. This is a skill that needs to be practiced and honed over a lifetime. You are going to improve at this, and that is our kind of goal with this, is we want to make you better at this. But keep in mind, this isn't something that you just do and then, like, once you have therapeutic communication, you never have to practice it again or never have to worry about it again. It's always something that you're going to be practicing, always something that you're going to be working on. I would also say, just as a side note, for the exam 1 that's going to be coming up in a few weeks, therapeutic communication is going to be one of the major things that is on that exam. So again, I really, really encourage you all to look over those do's and don'ts, really have a good idea in your head of kind of what each of those different recommendations looks like, how you can apply it to different situations, etc. So we also mentioned that nurses actually have the ability to run treatment groups. So treatment groups can serve a lot of different purposes. Here's 4 different types of treatment groups. We'll talk through them all a little bit individually, but also keep in mind that a treatment group can serve multiple purposes. So even though a group may be primarily a psychoeducational group, it can also be an activity group. So a psychoeducational group, for example, is a group that specifically focuses on teaching skills and content. So these can be things like how to manage your medications. It can be focus on problem solving or on anger management. Again, skills that the patients can get out of these groups. So focusing on that educational piece of it. Maintenance groups are designed to help reinforce stability. So these provide support to patients when they are transitioning out of a higher level of care back into the community. They can be maintenance groups helping patients stay on medication. So once they've been able to kind of achieve a level of stability, they're able to then kind of troubleshoot, like what are some of the problems that you run into when your medications maybe aren't working as well as you want them to, or you feel like you want to go off of your medications. A lot of these will also focus on reality orientation. So again, trying to maintain the stability of the patient as much as possible in these groups. Activity groups usually focus on facilitating interactions. Sometimes these can be recreational or exercise-based. These can also be activities where the patient is encouraged to do some self-exploration or increase their self-esteem, work on social skills. So these activity groups can take a lot of different forms, and one of the things that you'll notice a lot on the units is a lot of times, especially during your clinicals, you're not going to always have a kind of go, go, go mentality. This is a much slower clinical, and a lot of times these activity groups, just playing a board game with patients, can be really therapeutic because it gives the patients a chance to practice their social skills, to interact with someone who's not looking at them just as a problem or a bundle of disorders or of symptoms. Then self-help groups or peer support groups are groups that have members that share a common problem. So these aren't led by professionals. Nurses can still interact with these groups, but they are not going to be running these groups. So a good example of kind of the way these groups can serve multiple purposes is AA, or Alcoholics Anonymous. Alcoholics Anonymous is both a self-help group and a maintenance group. It's a self-help group in that it's led by non-professionals, by peers who share a common problem, and it's a maintenance group in that they are trying to maintain sobriety. So they're trying to maintain that level of sobriety in their participants. So again, this isn't a perfect division of, oh, it always has to be this or it always has to be that. Usually you do want to have a primary purpose involved in your group, but keep in mind that those can shift and change over time. There might be multiple purposes that are being served. So the last thing we're going to talk about in this section is the continuum of care. So when we're talking about the continuum of care, we're talking about the different levels of care that patients can be involved in. So these can be things like hospital-based care, like acute or chronic care centers. Good examples of an acute inpatient hospital-based care center would be Utah Valley Hospital, where we have patients that are going to be present for anywhere from a few days to a few weeks. More chronic care facilities are going to be like the Utah State Hospital, where we have individuals who will be there for months, maybe even years. Residential facilities or residential services are where individuals will access treatment that they'll be able to leave. So they're actually having their residents be at the treatment facility, but it's not a lockdown facility. So they're able to come and go. So they have a higher level of autonomy, in that they don't have to be there all of the time. They can leave and hold a job. They can go out with friends, but they have that kind of added stability of knowing that they'll have a place to live, knowing that they will have some of their basic needs taken care of. Day treatment programs are going to be like our Wasatch Mental Health Facility. So these are programs where patients will actually come to the program during the day, sometimes for a few hours, sometimes for the entire day, but they will then go home to their residence where they can live with family, they can live independently, they can live with friends, etc., etc. These can be really good options for people who need more intensive care, but don't need to actually be in that residential kind of custodial care. Traditional outpatient services are usually what we think of when we think of just therapy. So this would be, scheduling an appointment with a therapist, once or twice a week, seeing them on an as-needed basis for a longer period of time, but the patient is able to live autonomously, hold down a job, and things like that outside of there. The last one is self-help groups, and this, again, like we saw on the other slide, these are going to be non-professional-led peer support groups that don't offer the same kind of rigorousness that, like a traditional outpatient services would, but still offer some stability for the patient. So let's look at our first question here. So question 1, the primary element required to match an individual patient the primary element required to match individual patient needs with appropriate services is proper and thorough A, assessment, B, nursing diagnosis, C, planning, D, implementation, or E, evaluation. So the correct answer here is A. So to match a patient's needs with the appropriate level of care or the appropriate services they need, we need to make sure that we're doing proper and thorough assessment. So what I would like you to do is, in the first discussion, you're going to be given a couple of different scenarios with patients, looking at multiple different problems. And what you're going to try to do is match them with the appropriate level of care. There is not one right answer that I'm looking for with any of those. All of them are written pretty ambiguously, and I feel like there could be arguments made for any level of care with any of those patients. But what I want you to try to do is match them with the most appropriate level of care possible. What I also want you to do is think about when you're reading through those scenarios is what other information do I need? What other information would be helpful in matching this patient with the appropriate level of care? The two big guiding principles with all of this are you always want to be concerned with the patient's safety. Safety should always be our first concern. So we need to think about, is the patient's safety going to be jeopardized? If their safety is in question, how can I match them up with a level of care that's going to protect them? We also want to balance that out with what is the least restrictive circumstances they can be in. So if we only cared about patient safety, well, it would be really easy to lock all of our patients up in a padded room and not worry about any of their autonomy or anything like that, because we can make sure that they're safe in those circumstances. But we need to balance that out with what is the least restrictive service available to them. So even though a patient may benefit from an intensive inpatient setting, can they be seen in an outpatient setting? Can they be cared for that way? And what are our kind of deciding factors, or how do we discern between those? So go and complete this discussion and then come back for part 2 of our lecture. Thank you so much.